Hi VM family, we have confirmed one case of the coronavirus Tuesday of this week, and so therefore we know our team members are concerned, and I want to just take this opportunity to give you an update, a full update as to what we're doing at this point in time. Team, if you're experiencing symptoms similar to the flu, seeing that the coronavirus has symptoms that are similar to the flu, report that to your manager and report immediately to your doctor. Your doctor will then advise you as to how you can take the necessary precautions so that you are not back at work, at least for a period that is safe. If you have family members who have visited countries who have reported cases of the coronavirus, then you should report that again to your manager and also visit your doctor immediately. At that point in time, your doctor will advise you on the necessary steps that you should take to ensure that you are protected and to ensure that your loved ones are protected and to ensure that those you work with are protected. So we're playing our part in ensuring that we do everything that is in our power to curtail the spread of this virus. So therefore, with immediate effect, we'll be cancelling all mass meetings, all mass gatherings. However, we'll be using our digital channels such as Zoom and Skype for business to ensure that we still continue with meetings where necessary. Where business travels is concerned, local and international travel will be cancelled with immediate effect. However, where personal travel is concerned, I would just like to advise our team members that they should do the necessary due diligence, pay attention to both local and international news as to what's happening around us, and make it abundantly clear to your supervisor and your manager where your travel will take you. And the reason for that is that upon your return, based on where you have traveled, you may be quarantined by the Ministry of Health, as well as we may just take a decision as an organization to ask you to remain home for the next 14 days. One important question that many of our team members ask is what will happen in the event that one of our team members contracts the coronavirus and it goes beyond the 10-day sick leave that's allotted. We have taken a decision as a senior team that for those team members who can produce a sick certificate upon returning to work will not suffer any loss of pay as a result of the coronavirus. Okay, so we have activated the VM Group's business continuity plan. As a result of that, we have been working very closely with our leaders in the overseas operation. And as such, we're also guided by the restrictions that are laid out by the respective governments of those locations. So we have had new guidelines approved by our executive team for remote work. Our senior leadership team, supported by our management team in each location, is responsible for coming up with a schedule for remote work. Now, I'm aware that not everybody can go on remote work by the nature of their jobs. However, our senior leadership team will put rotating schedule in place where persons can stay at home for 5-day periods. As it relates to those who can work from home, there are certain specifications that we have to zero in on. So for example, we need to ensure that our team members have laptops that work, have VPN access. We also have to ensure that we forward our landlines to our cell phones. And for those persons who are in critical areas, may need to even reconsider their postpaid plans. So we're doing several things to ensure on a case-by-case basis that team members who are required to work from home will be able to work from home successfully.
As a result of the coronavirus, the VM Group has taken the position to put some steps in place to assist with mitigation. Now, we have increased the cleaning of our spaces. We have installed several disinfectants as also sanitizers and hand towels across our locations. To be more specific, when you enter our branches, you will see at the entrance the hands-free sanitizers. And the reason why we went hands-free was because we really don't want persons to be touching the devices. Right? When you come into our departments, it will also be on the entrance of our department. So when you come in or when you're leaving, you have the opportunity to sanitize yourself. We have also looked at giving, well, we are going to be giving material to the team members. So our frontline staff, more particularly our tellers, will be given gloves to assist with handling monies, because as you can imagine, the volumes of monetary transactions that they are doing. So we will want to ensure that they are protected from that perspective. We will be giving to all our frontline team members, so wealth advisors, tellers, the VMTS team, all persons who interface with customers or members on a daily basis. So if it's documents, if it's money, whatever the transaction, we will be giving them gloves to handle those things. Some of our larger branches or the high traffic branches will see an increase in cleaning activity in the public spaces. The smaller locations will see also increased cleaning activity. We recognize that more than the ordinary, there's going to be more than the ordinary use of toilet paper or hand towels. So what we have decided to do in our public spaces is to increase the trash receptacles so that persons can catch it, bin it, and kill it. Now, those receptacles will also be disposed of. The contents of those receptacles will be disposed of very, very frequently. All right, so we really don't want to create any kind of panic. And what the instructions to the security support is to ensure that they monitor the spaces to look at the persons who are coming on the inside, and to just pass on that information to the team leads so that the team leads can engage the members and, you know, point them into a sterile area to be sorted out. The security support has been advised to monitor the spaces more vigilantly. Now, because persons are going to be disguised wearing masks, we want to ensure that persons aren't entering our facility for any other means than to conduct legitimate financial transactions. So the security support will be vigilant where that is concerned. Persons, this is a financial institution, and persons are going to be required to produce their identification. Now, the teller will need to verify that the person who is on the ID that is presented is actually the person that is standing before them. So, persons who are wearing masks will be asked to remove to confirm their identity.
We care about the health and wellness of all our team members and their family, and so therefore we are doing everything possible in a collaborative way to ensure that our team members are safe. However, if you have any concern as it relates to your health and wellness, or even the health of a family member, feel free to make contact with your senior leader, the Human Resources Department, or any member of the Business Continuity Plan team, namely myself, Clover Moore, Nicola Anderson, and Carlin Wong. Please have a good day.